Question 80. Dana refuses to take a shower each morning. What approach should be taken by the SciTech student assigned to work with her? The answer is, the approach the SciTech should have reinforce her after she gets out of the shower. This is a Primack principle. Question 81. Bruce has to spend 15 minutes after work at CSI each time he is late. This was mutually agreed upon with the staff at Canyon Springs and the teacher at the annual review of his individual service plan. What technique is being used to modify Bruce's behavior? The answer is, the technique being used to modify is response cost. Response cost is desired outcome taken away to make up for undesired behavior. Question 82. A client frequently tears up his shirts. What is the best approach for the SciTech to take when the client is given a new shirt? The answer is, when a client frequently tears up his shirts, the best approach for the SciTech to take when the client is given a new shirt is reinforce for wearing a shirt and not ripping it. Use satiation by allowing them to continue ripping off clothes, followed by positive practice by having them do a session of dressing and undressing. Question 83. A client with a developmental disability engages in pica behavior whenever taken out on a walk. What is the best action to take? The answer is, when a client with a developmental disability engages in pica behavior whenever taken out on a walk, the best action to take is reinforce other behaviors while walking. Question 84. Betty Lou pinches one of her peers in the group room. What approach to changing behavior would be best to use by the group leader? The answer is, the best approach to changing behavior that would be best to use by the group leader is the exclusionary timeout. The exclusionary timeout is to remove the patient from the group area to the timeout room. Question 85. A client at a sheltered workshop works for an average of 15 minutes before tipping the chair over onto the floor. Each time the chair was tipped over, the staff removed the client from the work table and provided other job choices. What would be a better approach to managing this behavior? The answer is, better approach would be to offer a break or change in activities before 15 minutes have passed, and also encourage clients to notify the supervisor when they need a break. Question 86. The psychiatric technician is orientating a PsyTech student to a group of clients. How would the PsyTech describe the behaviors that would constitute an assault? The answer is, the PsyTech should describe the behaviors that would constitute an assault by an intentional threat by word or act to do violence to a person, with an ability to do so. Question 87. Bertha has been placed in a timeout room. What data should be recorded? The answer is, when a client has been placed in a timeout room, the data that should be recorded is the client's name, date, time of entry and timeout, time of timeout removal, reason for timeout, name of staff member monitoring them, confidentiality and legal rights and reporting responsibilities. Question 88. What should the psychiatric technician do when a person claiming to be a family member on the telephone inquires about a client? The answer is, what the psychiatric technician should do when a person claiming to be a family member on the telephone is refer to the hospital administrator of the facility. Don't give out any info, it is a HIPAA violation. Question 89. Under the Welfare and Institution Code of the State of California, individuals with a developmental or mental disability are provided with an advocate. What is the primary function of the client's rights advocate? The answer is, under the Welfare and Institution Code of the State of California, individuals with a developmental or mental disability are provided with an advocate. The primary function of the client's rights advocate is to work only for the client to ensure that their rights are not violated. Question 90. What action must the psychiatric technician take first when a client with a developmental disability asks for a writ of habeas corpus? The answer is, the action the psychiatric technician must take first when a client with a developmental disability asks for a writ of habeas corpus is provide the form and give necessary assistance understanding the form. Question 91. What is a client seeking when applying for a writ of habeas corpus? The answer is, what a client is seeking when applying for a writ of habeas corpus allow a person deprived of their liberty the opportunity to a court hearing where the individual seeking to detain them must defend their actions. The client has the right to know and be given evidence on why they need detainment. Question 92. What is the first step in the process by which an individual is found to be gravely disabled and a conservatorship is recommended? The answer is, the first step in the process by which an individual is found to be gravely disabled, a petition must be signed for court hearing to be held to determine conservatorship status. Question 93. With regards to the legal and civil rights of individuals who are involuntarily detained, what are the responsibilities that the facility must meet? The answer is, with regards to the legal and civil rights of individuals who are involuntarily detained, the responsibilities that the facility must meet are Allow equal access to all services and opportunities available. Clients' physiological needs must be met. Question 94. Know what the rights of clients are. The answer is, the client rights are: wear one's own clothing, have access to storage space, have visitors, make and receive phone calls, refuse lobotomy or psychosurgery, refuse electroconvulsive therapy, have access to letter writing materials and receive uncensored mail, refuse behavior mod which causes pain and trauma. Question 95. What actions should the psychiatric technician take after observing another staff slap a client with a developmental disability? The answer is, the actions the psychiatric technician must take after observing another staff slap a client with a developmental disability is: intervene, report to supervisor or instructor, fill out a special incident report and ask the physician to examine the client for injuries. Question 96. A psychiatric technician student observes a special education teacher handle a client roughly. What action should the PT student take? The answer is, if a psychiatric technician student observes a special education teacher handle a client roughly, they should report the incident to either their supervisor or instructor immediately. Question 97. What are some situations that may result in disciplinary action being taken against a psychiatric technician with regards to client abuse and reporting responsibilities? The answer is, some situations that may result in disciplinary action being taken against a psychiatric technician with regards to client abuse and reporting responsibilities are: physical and chemical restraints, corporal punishment, verbal abuse and seclusion when used as a punishment or for staff convenience, using restrictive approaches before trying lesser restrictive approaches. Question 98. Name some situations that provide good cause for denial of a specific right. The answer is, some situations that provide good cause for denial of a specific right are: if it causes injury or danger to self or others and no other less restrictive way is available. Question 99. What must be done before a right may be denied? The answer is, before a right may be denied, staff must provide training to the client in the correct exercise of that right. Question 100. What action must be taken first by the facility staff after a right has been denied? The answer is, the action that must be taken first by the facility staff after a right has been denied is, the client must be notified. A copy of restoration of rights must be given to the client, and the original copy is placed in the legal record. Question 101. For how long may a right be restricted? The answer is, a right may be restricted by 30 days maximum. Question 102. When should a right be restored? The answer is, a right should be restored when a good cause no longer exists, there's no threat. Question 103. What action must the psychiatric technician take after a restricted right has been restored? The answer is, the action the psychiatric technician must take after a restricted right has been restored is, tell them it is restored and remind them it can be taken away if good cause is given. Question 104. How often must the psychiatric technician document observations of a client who is in medical or behavioral restraints? The answer is, the psychiatric technician must document observations of a client who is in medical or behavioral restraints every 15 minutes. Question 105. A client has been placed in mechanical support, which is a non-restrictive protective device. What are some actions that should be taken by the psychiatric technician that is responsible for providing care to the client? The answer is, some actions that should be taken by the psychiatric technician that is responsible for providing care to the client are: observe and document every 15 minutes, reposition every 2 hours,